Hello everyone. This is the summary title of my research topic. My name is Endre-Botond Gagyi. I'm from Transylvania. I graduated last year from the Medical University of Marosvásárhely as a medical student. I came here on Erasmus scholarship and started a one-year program at the Translational Medicine Center. My vision regarding to this topic is that we can reach a state where we can prevent most of the patients from the recurrence and the progression of acute pancreatitis. My mission is to make better recommendations to patients by understanding the progression of AP into REP and CP and to show how common it is and to do attention to it. Since I'm here on at Fairmont's fellowship program, I'm working on one project at the moment. This will be a systematic review and meta-analysis. And it is called One Episode of Acute Pancreatitis is Just the Beginning, the Incidence of Recurrent Acute and Chronic Pancreatitis. Here you can see the co-authors of the project. Let me briefly introduce the background of my study. The incidence of acute pancreatitis varies globally, affecting from 5 to 80 people per 100,000, and it appears to be increasing around the world. Besides that, it may lead to a prolonged hospital stay and also associated with significant morbidity and mortality, and unfortunately, it can lead to recurrent acute pancreatitis and chronic pancreatitis as well. Data on the risk of developing REP and CP and factors affecting disease progression have been heterogeneous. Previous studies have shown that its progression to CP and REP has been reported to occur approximately from 4 to 24%, respectively from 17 to 35% of patients following a first attack of acute pancreatitis. This heterogeneity may be due to the fact that different studies have different follow-up times. Since the acute pancreatitis progression is time-dependent, these proportions will vary as a function of time. Therefore, our aim is to produce a statistically most accurate estimate taking into account the time factor to assess the incidence of recurrent acute pancreatitis and chronic pancreatitis in patients after different number of episodes of acute pancreatitis. As this is a study examining the incidence, the COCOPO framework is applicable for posing the question. This study does examine the condition of REP and CP in a context of after first AP, in the second case after a different number of episodes of REP in a population of patients. To achieve our goal, we have done a systematic search in 3 big databases using this search key. On the left side, you can see the Prisma flowchart of our selection out of 9,400 articles. And then we included 20 articles in the quantitative synthesis. These are our first results. On this figure, you can see 2 forest plots showing the recurrence rate of acute pancreatitis in the adult population and the pediatric population. The recurrence rate was slightly higher in the adult population. Here you can see the recurrence rate in adults based on the etiology of the first acute pancreatitis episode. The highest recurrence rates were observed for hypertriglyceridemia and acute pancreatitis, and the alcohol-induced acute pancreatitis. Here you can see the recurrence rate based on the severity of the first acute pancreatitis episode. The highest recurrence rate was observed for moderate acute pancreatitis. Here you can see 2 first plots showing the overall incidence rate of chronic pancreatitis after the first episode of acute pancreatitis and after REP. After the first TP is approximately 1 case per 100 person years, while after REP is approximately 4 cases per 100 person years. Here you can see the progression rate into chronic pancreatitis based on the etiology of the first acute pancreatitis episode. The highest progression rate was observed for alcohol-induced acute pancreatitis. Considering the strength of our study, this will be the first meta-analysis on this topic using this methodology. The strict inclusion criteria for acute pancreatitis patients, we included only articles where acute pancreatitis was defined according to the revised Atlanta classification, and the detailed analysis based on the severity and etiology of the first acute pancreatitis episode. Considering the limitations, the majority of the studies were retrospective, and the missing individual follow-up data, so we had to use the mean follow-up data to calculate these incidence rates. We found that the incidence rate is the highest in adults, hypertriglyceridemia-induced acute pancreatitis and moderate acute pancreatitis, while the progression rate is the highest in alcohol-induced acute pancreatitis and in recurrent acute pancreatitis. Using a formula by Rothman et al., we calculated the 5-year cumulative incidences to make our results easier to comprehend. We hope this can help clinicians in the risk stratification and can help patients to better understand their disease and can raise awareness among these patients. Therefore, our study draws attention to the needs of patient awareness, highlights the importance of secondary prevention by an intervention, and our study also highlights the need of prospective multicenter studies assessing acute pancreatitis progression with the same follow-up time for all the included patients, and where they report the individual follow-up data, not just the average follow-up data. Our work already was presented at the MGT and the EPC, and we will present at the UEG as well. Therefore, we would like to submit it to the American Journal of Gastroenterology. This is the current status of the manuscript. And thank you for your attention.
As I saw in the conclusions that HTG, hypertriglyceridemia-induced acute pancreatitis, increases the incidence of recurrent acute pancreatitis. Is this related to treatment? This is one of my questions. And is there geographical distribution with respect to the various etiologies and their effects? Have you looked at that?
Yes, both of them. So actually, when we investigated the patients, they usually have more confounding factors. They usually also heavy drinkers as well. And 2 of the articles, I think, from China, where is usually it is very high.
What do you think is behind being most frequent after a moderate and not a severe one, so being most frequent?
Yes, we have 2 explanations for this, which can partially explain. One is that a huge part of the severe cases die very soon, and the second is a large part of the pancreas tissue die from the severe inflammation, and this is reduce the opportunity to have an inflammation again.